Karen from Awaken Pilates here in Minneapolis, Minnesota. Currently I'm 25 weeks pregnant with my second baby, and today I have Kristen here with me, who's 8 weeks postnatal with her first baby. In today's podcast, we're going to go over some really great exercises to help kind of pull the pelvis back together by strengthening the hips, in particular the hamstrings, the glutes, the inner thighs, and the outer hip muscles. So I'm going to have Kristen start lying on her back, head up at this end. Her knees are going to be bent, feet flat, and her heels are in line with her sits bones, which is about a fist width apart. We're going to use a ball, but if you don't have a ball at home, you could use a pillow, like off of your couch or your bed, to hold between your knees. That's going to help create an inner thigh connection. Whenever we create an inner thigh connection, we're help encouraging the activation of the pelvic floor, which is obviously something that often needs to be healed after childbirth. So I'm going to have Kristen hold this right in between her knees, giving that ball a gentle squeeze. She's going to start in her neutral pelvis. We're going to just kind of warm up the body with some breaths. So she's going to take a deep inhale through her nose. On the exhale, I want her to think of knitting her ribs back together, kind of disappearing her ribcage into her shirt. Again, big breath in, and a deeper breath out. Simply by exhaling deeply, we're connecting the abdominal attachments. So we're getting some really great core work just with exhale. Let's do one more time. And on the next exhale, I'm going to have her tilt her pelvis, her pubic bone tailbone towards the ceiling. So she's doing a posterior tilt and release back towards neutral. And again, exhale, tilt. So she's coming into an imprint with her spine, with her lower back. And release to neutral. I want Kristen to think of the engagement of her pelvic floor and her low abs to create the movement versus her glutes. Sometimes people want to overly work their glutes here. We just really want to try to isolate the work in the low abs, which can often be weak or disconnected, even a little bit numb after childbirth. Great. And I'm going to have Kristen do one more time. And this next one, we're going to keep that tilt. And she's going to slowly peel her hips up into a bridge. So really giving that ball a little bit of squeeze. I want her to be in one long line from her shoulders to her knees. I want her ribs integrated in and down as opposed to popping up. So I'm going to have Kristen kind of disconnect for a second. Ribs are spewed open, which can really kind of compress the back. So I want those ribs down, abdominals in as much as she can. And then with her pelvis, I want her to try to tilt her pubic bone up towards the ceiling as much as she can. So she's getting more glute work versus her pelvis going towards neutral. That's just going to compress and arch the lower back. So go ahead and tilt under for me. Excellent. You're going to take another breath in. On the exhale, she's going to soften her sternum, her rib cage, and just slowly imprint back down into the mat. Releasing all the way to neutral. And again, abdominals create the movement. Then the hamstrings and glutes come into play. So you can tilt that pubic bone good, even more. And then rolling your spine back down. Great. And again, the inner thighs are working, the medial hamstrings are working because of this ball. It's really encouraging those solid connections. And rolling back down. Let's have Kristen do one more. And as she peels up, I really want her to think of bringing her body kind of towards her feet versus pushing away from her feet. This one she's just going to hold and deepen the work at the top with some breaths. Good. So keep thinking pubic bone tilting higher. Excellent. It's like she's trying to pull her abs away from her inner thighs. Knitting her ribs together, toning up her arms into the mat, her upper back, feeling her feet grounding. And one more breath in, tilting under even more. Good job. And slowly rolling all the way back down. And let that release. Great. I'm going to take the ball out. I'm going to have Kristen rotate into her left side to do some hip work. She's just going to make a pillow with that bottom arm for her head. Her hips are stacked, knees are stacked, and her heels are stacked up. I want her top waist to really reach long, so we're creating length from her bottom ribs to the top of her pelvis. Same with that bottom side. The obliques and the transverse kind of hug the body and spine stable as she's lying on her side. On her inhale, she's going to rotate her top knee open, just like a clam shape, and then lower it back down. And again, open, good, and down. My goal for her is that her knee is able to get above hip height. So we're getting those external rotators in the back of the hip joint to really contract and fire up. She can intensify the work by pressing her top heel down into her bottom heel, kind of squeezing those heels together. Creates a lot more intensity and just got a little more shaking going on. That's good. For 2 more. Last time, rotating up. Great. Now she's going to lift her knee and her bottom foot or top foot up, parallel to the floor, and back down. So it's just like a hip hinge. The movement's happening right in the hip joint, not in the waist or the spine. That's all stay long and stable. Good. Think about going just straight up above that bottom knee and straight back down, making sure that they go all the way down each time. So on the way down, we're getting the eccentric work, that slow release happening. Let's try 2 more after this. Lifting. Great. And 1 last time. And down. Good. You can rest that. So all these exercises are really great because they help to strengthen the muscles around the pelvis, which will help to pull the pelvis back, offering a lot of support, but back together. All the relaxant that we have going in the body can help those joints, or kind of make those joints feel really unstable or loose. So using the strength that we have within our own bodies can help pull things back together again. Hope you enjoyed it. Obviously, you want to do the other side, but just for time's sake, we're going to have Kristen only do this one side. Doing about 8 to 12 reps on each side, each exercise would be great. Hope you enjoyed it. We'll see you next time. Thank you.